Imagine adults taking lessons in the preparation of porridge. In Dima sub-county in Kiryandongo District, a group of mothers gather to demonstrate what it takes to prepare a nutritious meal for their children. While many people may think porridge is prepared in only one way, here the women are learning different methods by adding ingredients like peanut paste and a little oil to improve its nutritious value. This is one of the community care groups formed in the area to expand nutrition education and help fight malnutrition in the district. During one of the sessions, members demonstrate how to prepare nutritious porridge and balanced meals for children using locally available ingredients. From the reactions of those tasting the meals, the food appears not only nutritious but also appealing. The groups bring mothers together to learn about early screening for malnutrition, behavior change, and the importance of balanced diets for children. In a district where malnutrition cases remain high, these community-led interventions are helping improve awareness and prevention.
After listening to the message, speaking the message, like I already full with the message. The task is given to me to go back where I'm living, to my neighbor mother, my neighbor father, to form 15 members, like we are 15 here.
Provide them information that is also related to their very own context. Like in this particular settlement in Kiryandongo, there are many, many cultures. So to understand the different foods they eat and also try to teach them in a manner based on their different cultural context.
Despite these efforts, the district continues to grapple with high levels of malnutrition. Nutrition screenings show global acute malnutrition at 15.6% and severe acute malnutrition at 4.7%, with several factors driving the problem. Like many districts across the country, agriculture is one of the activities carried out there to improve livelihoods. However, despite the fertile land and farming activities, malnutrition remains a persistent challenge driven by factors like poverty, cultural beliefs, agricultural priorities.
Like this sub-county, there's a lot of tobacco growing. So that tobacco growing, it is a cash crop, it is not a food crop. Meaning they're not going to harvest it and eat it. They have to wait for the time when it is ready to sell it. Then they can be able to get some money.
However, this focus on cash crops has had unintended consequences. In many refugee-hosting communities, the emphasis on tobacco cultivation means less land is allocated to food production, leaving some families with inadequate food supplies.
This community, they like planting maize mainly as the food crop, and you find a family year by year they are eating posho and beans, posho and beans, posho and beans. When they are changing, they eat cassava. So you find that lack of dietary diversity.
For refugees, the situation is even more challenging. Many have limited access to land, making it difficult to grow additional food to supplement official refugee rations. In some communities, families delay the search for medical care when children fall sick, believing the condition may be caused by witchcraft. By the time some children are brought to health facilities, they are already in critical condition. Despite these challenges, there is some progress due to government and donor efforts called to prevent and detect malnutrition early. These interventions include support to village health teams and community care groups that provide nutrition education and peer-to-peer support among mothers and caregivers. Using simple tools such as the mid-upper arm circumference tape, village health teams can quickly assess the child's nutritional status. The tape is color-coded to help identify the level of malnutrition, For example, if the tape shows green, the child is considered well nourished. And if a child is diagnosed with severe malnutrition, treatment starts early. One of the mothers who has benefited from this intervention is 19-year-old Jovia Kawambe from Dima Sub-County. After giving birth, Jovia fell ill and struggled to breastfeed her baby. Without adequate feeding, the child gradually became malnourished.
So because of the continuous screening that we have been doing, supported by UNICEF, and we were able to identify cases early, cases were being referred, and they received intervention. So we see our global acute malnutrition coming down to, the last update was in October 2025, coming down to 7. So this is quite impactful because now we are seeing where we are going.
However, health officials are calling for more support, including nutritionists, whose services are in severe demand due to the large refugee population. With declining donor funding, some health workers who previously supported nutrition programs have already been laid off, placing additional strain on the health system.
At least we are supposed to have 4 nutrition officers, but we only have 1. The hospital is supposed to have at least 2, and also the health center is supposed to have at least 2. But we only have 1 who is currently here, and you see he does the coordination and as well as the clinical intervention.
Kiryandongo District is home to more than 365,000 people and is one of Uganda's major refugee hosting districts, currently accommodating about 165,045 refugees. Nobat at Kunda, ATV News.